Knock, knock. Hi, my name is Sarah. I'm going to be your nurse today. I'm going to wash my hands. I'm going to check your wristband really quick. Okay, and you are Mr. Jones. So yes. Okay, and what's your date of birth? You're 69 years old, right? Okay. Correct staff name is on the board. There's no oxygen on right now. There's no feeding tube, no abdominal wounds or drains present. No chest tubes are present. No trach is present. No Foley catheter. No IV or saline locks are present. The side rail, 2 side rails are up. As I see, the bed is in the lowest position. The call light is within reach. Obstacles are not on the floor. They're not cluttered from the bathroom to the bed. There's no obstacles at the bedside. There's no mess around. Patient assistive devices are within your reach. There's a urinal at the bedside. There's no toilet. There's no commode in here. The toilet is empty, and there's a trash bag attached to your little side table. So, Mr. Jones, do you know what today's date is? What is today? Saturday. Good. Do you know where you're at right now? The hospital? Good. And what is your name? Mr. Jones.
Mr. Jones.
Good. Okay. Go ahead and look at me. Okay, smile. Good. Nice, even face symmetry. Okay, go ahead and look at me again. I'm going to check your eyes. Could they dilate? They're nice and even and round. I'm going to go ahead and listen to your heart. Can you move your arm? There you go. Good job. Good. Now I'm going to listen to your lungs. Okay, so take a deep breath. Good. Take a deep breath. Good. 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 Lift up your arm. Good. Deep breath. Good. Other side. Good. Nice job. Okay, so, when's the last time you had a bowel movement? Say today. Good. Can you lay down for me? I'm going to listen to your belly. Are you having any trouble urinating? No. Any burning or stinging while you pee? No. Okay. I'm going to go ahead and listen to your belly. Are you having any pain anywhere? Yes. And where's your pain? in your belly area. Okay, go ahead and here. I'm gonna feel your belly. Okay. Does that hurt whenever I touch it? No. No. Good. Okay. Go ahead and sit up for me. Okay. Now go ahead. Grab my 2 fingers and squeeze. Good. Pull. Good. And then push. Good. Okay. Can you go ahead and let me see your hands? I'm checking for cap refill, which is good. Which finger am I touching? Good. Which finger am I touching? Good. Go ahead and lay down for me. I'm going to check your toes out. Are you having any numbness, tingling, or strange sensations on your toes or feet? No, good. Okay, there's no edema present. Which toe am I touching? The second one? Good. Which toe am I touching? The big one? Okay, good job. Okay, so what I've found in your head to toe assessment is your heart rate is a little bit, your heart rhythm is a little bit fast. So I'm going to go ahead and check. Sit up, please. Sit up, please. There you go. We're going to go ahead and do some vital signs. So I'm going to use your finger. Okay, there's a pulse ox on there. Look up at me. Under your tongue, an imaginary thermometer. Good, under your tongue. And check your blood pressure. Good, so your blood pressure is 150/72. 110 is your pulse. Respirations are 24. Temperature is 37.3. And it looks like you've gained 3 kilograms from your last appointment a couple days ago. Is that right? Yeah, and you have a heart history where you had previous stents placed. Okay. Well, we're going to go ahead, and you're feeling a little bit short of breath over the past couple days. Okay. So we're gonna go ahead. We're going to get a chest X-ray, an ECG, do some blood work to include your ABGs. They'll draw it from here. CBC, which they'll just draw normal through a vein. We're going to check your electrolytes, your lipids, your liver function panel, your thyroid, and your kidney function to see how everything pans out. Does that sound good? Okay. If you have any questions, just let me know, but I'll be back in whenever all of this is ordered. Sounds good? Okay, go ahead and relax. Call light is within your reach. Hi, Mr. Jones. Wash my hands. Okay, so I'm going to look at the labs here. And it looks like your BUN is 17 milligrams. Your creatinine is 1.2, hemoglobin and hematocrit 11.8 and 36%. Your LDL is 705. Your BNP is 843. We're going to go ahead and admit you to the cardiac unit, so we can place you on telemetry to look at your heart. Does that sound okay? Okay. Alright, go ahead and lay back down. Knock, knock. Wash my hands. Hi, Mr. Jones. It seems like you've been on the tele unit here for a couple hours now. I'm going to go ahead and do some a little assessment on you because it looks like you're a little clammy and it feels like your skin is pretty cool, okay? So let me go ahead and listen to you. How does your stomach feel? Does it still hurt a little bit? Okay. It seems like you're breathing pretty fast right now and you're pretty labored. So go ahead and sit up for me. Sit up. There we go. Good. Just take breaths whenever I place the stethoscope on you. Good. It seems like you're gasping for air right now, too. Is that so? Okay. So what I'm hearing right now is I'm hearing some crackles in both of your lungs, and I'm hearing an expiratory wheeze. So what I'm going to do is I'm going to check your oxygen level again. So go ahead and let me see your, sit up please. Go ahead and let me see your finger. Okay, we're checking your O2, your oxygen level. And it looks like it's at 88%, which is a little bit lower than what we'd like to see. So what I'm going to do is I'm going to put you on oxygen. So that's just going to be a little tube that goes in straight in your nose, doesn't go any farther than your than here, and it's going to help your oxygenation. Okay? All right. So here's the oxygen, and it's on. Okay? What we're going to do is we're going to sit you up in bed a little bit. So your lung expansion, so it helps with your lung expansion. So here, sit up nice and tall, and we're going to prop your arms up too. Oops. Go and sit up for me. Good. So we're going to prop your arms up too so your lungs can get as big as they can get. Are you comfortable? Okay, good. Alright, so your blood pressure, I'm going to recheck your blood pressure too. And now it's at 190 over 100. Your heart rate is 130 and irregular. Your respirations are at 43. So I want you to go ahead and uncross your legs, and I want you to relax, okay? Think of something nice and relaxing. Everything's going to be okay. We're going to get you taken care of, okay? Breathe in through your nose and out through your mouth so we get that oxygen coming in through your nose, okay? Okay. I'm going to come back and check on you in just a couple minutes. I'm going to go check some orders. Sounds good? Okay. Wash my hands. Hi, Mr. Jones. Sarah here. Wash my hands again. Are you feeling a little bit better? A little bit? Okay. So it looks like you are having some worsening of your heart failure. And those crackles that we were hearing is called pulmonary edema. So your heart's not working well enough, and so you're having fluid buildup. Okay? So that is what's leading to your shortness of breath and your reduced O2 saturation. Does that make sense? Okay. And I did forget to note too, whenever we were doing my assessment just a couple minutes ago, that you did have a positive JVD, so that's your jugular vein right here. It was distended, and that means that your heart isn't pumping well enough because there's too much pressure. So your heart isn't strong enough to pump all that blood to where it needs to go. Okay? So what I think the doctor is going to do, I believe that he's going to put you on digoxin, which is a heart medication, and it helps your heart pump more efficiently. So it's going to pump stronger to force that blood flow out. Does that make sense? Okay. And then what we're going to do also is we're going to put you on a diuretic. And hold on. What? Here, stand here and help me. So what we're going to do, the doctor, this is Dr. Maverick. Come here, Dr. Maverick.
Why?
we're going to put Mr. Jones here on a diuretic. And a diuretic is going to help flush all of that extra fluid from your body. Okay? So hopefully that'll take care of your pulmonary edema, that's where we have those crackles, and any kind of swelling that may exist. Does that make sense? Okay. So I am going to go ahead and report off. I am doing something for my homework. I am going to report off.
Are you doing my buffer?
Oh, hold on 1 second. Shh. After we go over where you're at right now, so we are in the CCU. We've been treating you aggressively for heart failure. You've been on IV furosemide, which is Lasix. You stay right here. You've been on Lasix, which is your diuretic, through your IV, and then Digoxin, which is through your IV as well. Okay? So I'm going to go ahead and report off to the nurse. So you just hang tight here, get comfortable, and if you have any questions in the meantime, just let me know, okay? Okay. Alright. Hi Jane. I'm Sarah. This is Mr. Jones. He is 69 years old. He came to us in the emergency room after visiting his primary care physician, complaining of fatigue for the past 4 days, shortness of breath, and some abdominal discomfort. He does have a past heart history, 90% LAD blockage and 50% RCA blockage with both stents placed in both. Since then, he's been okay until now. His baseline vital signs were 150/72. His heart rate was 105. Respirations were 24. Temp 37.3. He did have a 3 kilogram increase in weight from a couple of days ago, from 3 days ago, upon admission. Since admission, his blood pressure spiked to 190/100, and his heart rate did spike to 130. His respirations were 43. We did put him on O2, 2 liters initially. He did end up with pulmonary edema, and that is due to left-sided heart failure. His JVD was present, and that is a sign of right-sided heart failure. He is on IV Lasix and IV Digoxin, and those have been helping. He's received 80 milligrams of IV furosemide and 0.5 milligrams of IV Digoxin. Both of those, one is in his left anacube, one is in his right anacube. His O2 is now at 96%, and he is on 4 liters of nasal cannula oxygen. He is pleasant, and he is alert and oriented ×4. What questions do you have? Okay, good. So no questions. Mr. Jones, Jane is going to take care of you from now on, and if you have any questions, you can ask her, okay? Okay, good. I hope you get to feeling better.